It's important to manage your diabetes, no matter what age you are and what type you have. In this video, we're focusing on the issues that face adults with type 1 and type 2 diabetes.
And for some great information on diabetes management for children, check out For Parents and Kids at diabetes.org. In type 1 diabetes, your body does not produce insulin, so you must take insulin in order for glucose to leave your bloodstream and enter your cells. Type 1 diabetes used to be called juvenile diabetes because it often occurs in people under 30. However, it can occur in people of any age. If you have this type of diabetes, you often have a high level of auto-antibodies in your blood. While antibodies protect your body by destroying bacteria and viruses, for example, auto-antibodies attack your body's tissues. In type 1 diabetes, auto-antibodies attack the cells in your pancreas that make insulin, called islet cells. The exact cause of type 1 is still unknown. In type 2 diabetes, the body may not make enough insulin, and/or it may not properly use the insulin it produces due to the development of insulin resistance. Most people who develop this type of diabetes are over 40 years old, although we now see it occurring in much younger people, with an increasing number of children diagnosed in recent years. Type 2 diabetes runs in families, and there are genetic factors involved. Extra weight may also cause insulin resistance. With insulin resistance, your pancreas continues to make some insulin, but cells in your body don't respond properly to the insulin. As a result, blood glucose cannot get from the blood into most cells. This is why maintaining a healthy weight is so important when you have type 2 diabetes. Additional risk factors include smoking and high blood pressure. Your healthcare provider will provide you with guidance and prescribe the appropriate medication when needed to deal with your specific situation.
Women who have high blood glucose levels but don't already have type 1 or type 2 diabetes may develop diabetes during pregnancy. Called gestational diabetes, this type typically is discovered at approximately 24 to 28 weeks into pregnancy, when a pregnant woman's body is making hormones to help the baby grow. Those hormones can block insulin from doing its job and cause insulin resistance. The risk factors for gestational diabetes are similar to those for type 2 diabetes, with the highest risk factors being prior gestational diabetes, being overweight, or a family history of type 2 diabetes. Your risk is further increased if you're over age 25 or have previously given birth to a baby weighing 9 pounds or more. When a mother has gestational diabetes, there are some possible risks to mother and baby. For the mother, these include hypertension and the need for a C-section. For the baby, the potential risks include low blood glucose at birth, breathing challenges, and a high birth weight, which can cause several health issues, including damage to the shoulders during birth. Fortunately, gestational diabetes usually disappears as soon as the baby is born. However, a woman who has had gestational diabetes is more likely to develop type 2 diabetes in the future. For this reason, it's important for women with gestational diabetes to schedule a 6-week follow-up visit with their doctor after their baby is born. In fact, studies are now showing that pregnant women who have high blood glucose at their first prenatal examination may actually have type 2 diabetes. For this reason, they should be carefully screened at this 6-week visit.